Hello everyone. Today I'll be presenting Wiskott-Aldrich syndrome. My name is Sumit Salma and I'm currently a third year medical student at Down Medical College. So let's begin. Wiskott-Aldrich syndrome is a rare syndrome and is described as a classic triad of microthrombocytopenia, eczema, and recurrent pyogenic infections. This is also known as eczema thrombocytopenia immunodeficiency syndrome. This syndrome is normally presented in an X-linked recessive inheritance pattern, but it can also result from spontaneous DNA mutation affecting hematopoietic stem cells. Most commonly, it is seen in males older than 2 years of age. It is classified as a progressive loss of T lymphocytes in peripheral blood, lymph nodes. Because of this, there is an impairment of T cell mediated humoral immunity. Causes and complications of Wiskott-Aldrich syndrome. So this basically arises due to a mutation in the Wiskott-Aldrich syndrome protein gene, which is also known as the WASP gene. This gene encodes for hematopoietic cellular proteins involved in cytoskeletal architecture, mainly those which are seen for making pseudopods. Because of this, there is an increased risk of infections, bleeding, autoimmune disease, and malignancy. Signs and symptoms are thrombocytopenia, which manifests as petechiae, bruising, epistaxis, and severe bleeds. Eczema manifests via atopic symptoms, and there's also recurrent sinopulmonary opportunistic infections caused by encapsulated bacteria, such as strep pneumoniae, H. influenzae, and Neisseria meningitis. There are also some fungi and viruses which can also be observed. So the diagnosis for this is made via certain labs. So labs can show low to normal IgG and IgM, while they will be showing high IgA and IgE levels. There will be decreased number and function of T cells, and the peripheral blood smear will show fewer smaller platelets secondary to cytoskeletal remodeling. Diagnosis can also be made via genomic DNA sequencing, flow cytometry, which will be used to determine the WASP gene status. Other methods for diagnosis include a history of bleeding, recurrent infections, eczema, or a positive family history with this condition. The treatment involves medications which are administered prophylactically, like prophylactic antimicrobials and intravenous immunoglobulins for recurrent infections. It may also be preferred to go for surgery, and for surgery, splenectomy will be performed. Platelet transfusions and blood transfusions can also be considered. The best definitive treatment, not even definitive, but the best treatment currently is HSCT. So these are two photographs of people with this condition. We can observe the petechiae quite evidently. So that's the end of my presentation.